And good afternoon. We're getting ready to start our lumbar Deuk laser disc repair. This patient has not so much back pain, but more right leg pain, shooting down her leg. Shot. Now she's got a lot of problems with the spine. We did our review with her. I need you to get that L5 pedicle lined up better. See how the pedicles are off on the x-ray? It's going to be a WAG issue. Anyway, she was recommended to have several discs fixed, but she's elected just to have the one, and that's fine. We're going to go for the worst one. Sometimes that's what happens for our patients, is they choose to just get one fixed rather than fix them all. I don't know if you think we're good there? We may be okay. It just seems like that L5 is weird. Really weird. Now she does have scoliosis. She has listhesis. She's got a lot going on. I think we're off on WAG. Let's try to WAG it back up. I want to see the superior end plate of 5 line up perfectly. Shot. Let's go, Jordan. Yeah, you know what? I think that is better. Don't you agree, Jordan? You agree? Yeah? All right, let's see what we can do here. Shot? So our patient's primary problem for this surgery is going to be basically right leg pain. Shot? She has really bad sciatic pain shooting down her right leg. If you look at her MRI there that Henry's got for you at the bottom of your screen, you can see she's got a foraminal herniation. Foraminal herniation. That is a herniated disc sitting in the neuroforamen. A really big herniation, by the way. Shot? I need an AP. Can I pull my mask up a little? I don't know what it is with these masks. Are these? I thought you were getting the ones with the sponge. The anti-fog.
They are bad. They are not there. There's another one. You can try these ones. The one that I'm using, they're better than this one. It's a big box. Try.
Are you telling me you're holding out on giving me the better mask, or holding out for yourself?
It's in back order. I can't find it.
No, but you're saying you're wearing a better one. But why didn't you give that to me?
I don't know.
Switch mask.
I see that you were wearing that. Also.
I just grab whatever you guys put out there. Yeah. Yeah, no, this is horrible because it's sliding off my face. All right. All right, we're making our way down. Sean, I feel the herniation. AP. So we are at L4-5 at this point. You can see the sacrum. You can see the 5-1 disc. It's pretty degenerated. We're at the L4-5. And, yeah, look at the scoliosis, how twisted it is there. Man, what a mess. How's she doing?
Okay.
All right, we're getting there. Let me know if she experiences any discomfort.
You doing okay? You doing okay? How are you in there?
Shot? Mm-hmm. She was asking me about this discogram. How far off are we? Should we just proceed?
A couple minutes. She's very sleepy.
Shot?
Let's give her a little.
All right. Yeah, we'll just proceed. We know she's got a massive herniation. You can see it there. Give me an AP. So her problem is her nerve root is being absolutely crushed at L4-5 in the foramen on the right side. You could see it on that MRI. Okay? So we are now entering her foramen on the right side to remove that herniation. Now sometimes patients are going to wake up when their nerve is being crushed this bad. They have numbness, they have weakness, and they're going to have that for a while because this surgery does not fix nerve damage. There's no surgery that fixes nerve damage. Okay? Nerve damage is nerve damage. She's got nerve damage, just like lots of people. But what you want to do is get the nerve that's being crushed uncrushed so that it can heal. And healing takes time. Henry, let's show our audience how does back pain. Now her problem isn't really back pain, but we'll show you anyway. How does a herniated disc cause back pain? Shot? Let's get a num-num. All right, welcome back. You can see from our video that people get back pain because their herniated disc causes inflammation, and that inflammation in turn causes back pain. Her biggest problem is the nerve is being absolutely crushed here at L4-5. She's got other discs that we wanted to fix, but she just wants us to fix the one. And what I was saying earlier is when a nerve root is being crushed for so long and so hard, it causes damage to the nerve root. She has nerve damage. There's no doubt about it. We verified that with our nerve test. But, you know, when people have this much nerve damage, they get weakness in their leg from the nerve being crushed. They get numbness. They get tingling. They get pain. Now, when we're done with the surgery, those things aren't just going to magically go away. The nerve has to heal. And the nerve healing can take a year, maybe even longer in some people, but we tell everybody up to a year. That's what she's got. There's the herniation. You can see it's blue. We're going to take, there's a big herniation. We're going to take it out. It's going to come out in a few pieces. All right. Any questions, Henry?
Yes, we have a question from Shelby on Facebook.
Hello, Shelby.
Asking, is there a reason why some heal and some don't need to repair?
Yeah, that's a great question. So Shelby, disc herniations never heal on their own. And the people that tell you they do, they don't know what they're talking about, okay? Now, what can happen with the disc herniation is the symptoms that the patient feels, the back pain, the leg pain, the weakness, numbness, tingling, those can go away. So the symptoms can go away, but the actual herniation itself does not heal. Now, there are people online that will show you an MRI before and after, 12 months later, 6 months later, and you'll see a change. And what's happening is, number one, they're showing you a different spot, okay? MRIs are not pictures of real things. They're actually a very sophisticated technique where magnets are used, external magnets are used, the machine, to excite protons in your tissues, which then start vibrating very fast and very energetically, and then those protons release their energy. And when the magnetic field is removed, they release their energy. And they release their energy in a very characteristic way, so that water, for example, pure water releases it a certain way. Spinal fluid releases it a certain way. Fat releases it a certain way. And then there's a detector on the MRI that actually detects the release of energy from excited protons and captures it. All right, and that energy comes out in different wavelengths and frequencies depending on the tissue. So an MRI is a very sophisticated thing, and it doesn't show you exactly what you think. So the image that you're looking at with the improved herniation is either in a different location, or the volume averaging was done differently by the different MRI. The only way you could really see a herniation disappear is if you took exactly the same MRI with exactly the same sequence in exactly the same place. That means the patient would not be able to move at all going from one MRI to the next. They would have to lay in exactly the same spot on the same MRI and use exactly the same settings, which is almost impossible to do, okay, in reality. So what you see is you see an MRI done on the same patient 6 months apart, but the actual pictures are different because they're from different locations. All right. The reality is herniated discs do not heal on their own. We used to believe they did, but they don't. We found out the reality. People's symptoms always come back until they get fixed. And it's just a matter of time. But your symptoms can definitely get better. There's no doubt about that. That doesn't mean your disc is healed. The disc is still herniated and the problem is still there. It's just not acting up at that time, and we call it less symptomatic or asymptomatic. So that's the reality. Now, that said, there are lots of people who their symptoms go away, and they stay away for a long, long time. And it turns out, in a lot of those patients, they've modified their behavior. They've modified what they've done. There's a piece of herniation, pretty good size. So they've gone from being active to being inactive. They go from, playing sports and walking the dog, playing pickleball, to basically just sitting on the couch. And they get adjusted to that new lifestyle where they're just laying around. And, if that's okay with you to have an inactive lifestyle, then by all means don't get surgery, don't get it fixed. But on the other hand, if you're a kind of person who wants to have an active lifestyle and not have any restrictions or limitations, then herniated discs don't go away magically. Here comes the big one. It just broke. It just broke into a piece right there. So I thought I was going to get it out. Here it is. That's the big one right there. She has a huge herniation, and I'm trying to get it out, but it won't fit. Oh, here it comes. Here it comes. Get ready. Henry, get ready. Get the light over here. Oh, it just broke again. I felt it. It's too big. There's a piece. It's stuck in the tube. This thing is going to be huge. Henry, you ready for this thing?
Yes, sir.
Here it comes. Look at the size of this. It's literally creating a sucking. Oh, look at that thing. There it is. Look at that. That's a beauty. Smack its ass and give it an APGAR score. We just delivered. That's not even the whole herniation, by the way. That's the one that was pushing on the nerve. Okay? Can you guys see that?
Yes, we can.
So look at all this. We're doing all this to a tiny little straw. That's the incredible procedure. I did not develop the transforaminal approach. That was done by Dr. Parvez Kambin. He's an Iranian orthopedic spine surgeon. He developed this approach, this technique, years ago, like back in the late 80s. And he was at Pittsburgh, and he taught his residents to do this. And one of those, or a couple of those residents taught me, okay? He was the first one to pioneer this transforaminal lumbar technique, okay? And now, of course, we've improved on it over the years, so it's a lot better now than it used to be. But his instruments, when he first did it, were really not meant to be used for spines. So he had to build his own instruments. Nowadays, there are companies that oh, here's another one. There are companies that manufacture these instruments, and they're all FDA approved, you know, so the government has signed off on them, and they're very safe and very effective if you know what you're doing. All right, Henry, do you have any questions? Almost done, Dr. B. Like 5 minutes here. Thank you.
Yes, this next question comes from Tony on Facebook.
Who?
Tony.
Tony. All right. Hi, Tony.
They asked, or they said, this is a comment, and they said, I have radiculopathy at L5, EMG confirmed, but the MRI is clear.
Yeah. Well, Tony, I would come to Deuk Spine to get it fixed. That's what I would do if it was me. Why? Because we're doing things here at Deuk Spine nobody else is doing. The other doctors, they're going to want to drill holes in your spine. They call it a microdiscectomy or a laminectomy. And they're going to weaken your spine, and your spine's going to start wobbling even more. You're going to have to come back and get a fusion. They're going to tell you, oh, now you need a fusion. So we've never told our patients they need a fusion. Okay? I had one patient in 17 years, I told him he needed a fusion. And that's because he was absolutely butt nutty crazy. And that was like the only other thing I could think to get rid of him. Just being brutally honest here. But he had, what he really had after we fixed him was he had severe atrophy of his muscles. Severe. Because he had let it go for so long. And that's not his fault. Okay? I don't blame patients for, you know, waiting to get themselves fixed. Right? I mean, but it is a choice you have to make. And if you wait so long that your muscles deteriorate, because that's what happens, by the way, your muscles deteriorate. If you have a disc herniation and you have bad back pain and you wait for years to get it fixed, your muscles are going to deteriorate. And so I tell all my patients before surgery, I say, listen, I can fix your disc, but I can't fix your muscles. I can't fix your nerve. Your nerve and muscles must heal on their own. And I cannot speed that up with surgery. That is something you're going to have to do with therapy and time. Laser. You sleeping over there? Don't make me call Destiny in. So, you love it. I mean, if I can get my staff to laugh like Luis, I'm very happy. I'm always trying to, like a little jab that makes people laugh. That's me, Mr. Funny. Right? I have always enjoyed making people laugh ever since I was a kid. Got me in trouble in school, but it was worth it, you know, as long as I got some good chuckles by the people I cared about. All right. So long story short, getting back to the comment I'm making, I think I actually made all my points that I was going to make. So what other questions do we have?
This next question comes from J Rock on YouTube.
J Rock, welcome back.
They said, so I hear you say this is the future and no need for fusion or replacement disc. But as for you, what happens when you can only get on one side and not the other side of the disc?
Yeah, what happens when you only get on one side and not the other? Great question, great observation. Basically, if the other side is not causing symptoms, you don't need to treat it. And so if somebody doesn't have pain coming from both sides, they don't need both sides treated. We usually don't go to both sides of the disc for disc pain. We go to both sides of the disc because the patient has leg symptoms on both sides. And it's very rare that we cannot get to the disc to fix it. There are some patients that we can't. It does happen. Probably, if I had to guess, 1 out of 100 patients, or 1 out of 100 discs, I should say, that we're not able to get to, that we were going to get to. And every time that I've had that situation, I've not seen one patient yet that had symptoms coming from the disc side that we were not able to get to. In other words, if that disc is not is not reachable with this procedure, it's usually not because of anything I did, it's because of the patient's body, and their body is enlarged the bones in that area so much that it makes it impossible to get to the disc through that side. And if that's the case, that bone enlargement is usually stabilizing that joint so that it's not painful. In other words, the fact that I can't get there is because of enlarged bone, and that enlarged bone actually usually stabilizes the joint enough that it doesn't cause symptoms. So we wouldn't know that ahead of time, of course. We would only know that afterwards when we couldn't get to it. Now, if somebody's still having symptoms of back pain or leg pain after surgery, the best thing to do is to come and get evaluated and figure out why. And I really doubt that it's going to be the area we're unable to get to. But if it is, then a fusion would be necessary. So, considering all the things that I've said, if you have 1 out of 100 discs that we can't get to, and that's 1%, and then if out of that 1 out of 100 we couldn't get to, that 1%, probably 1 out of 10 of them, so 10%, would actually need something done, like a fusion. So that's 10% of 1%. So we're talking 0.1% of people would need a fusion. That's a pretty low number. Right now, 100% of people are being recommended for the fusion pathway, the pathway to fusion. But if you're recommended for the pathway to fusion and you do a fusion, well, then you're 100% going to have a fusion. But if there's a 99.9% chance you don't need that fusion if you do the DLDR. So, yeah, I would say that's pretty consistent with everything I've been saying. Fusion is going to go away except for a small number of people. Probably less than 5% of the people getting fusions today will need fusions in the future, if their surgeons know how to do this surgery. But the surgery doesn't work 100% of the time. It works about 99.9% of the time. And there's always going to be that one person who it doesn't work for. All right, we just got a few more minutes here. Great question, J-Rock. Thanks for bringing it up.
We have a few more questions. This next one comes from Shelby once more on Facebook, asking, what makes someone interested in laser versus disc repair? Is it normal to do laser but not heal and turn into replacement?
Sorry, my pedal moved and I got a little distracted. I didn't really understand the question. Do you understand the question, Henry?
What makes someone interested in laser versus disc repair? That I understood.
Talking about somebody like a surgeon or a patient?
I think just a patient in general. Is it normal to do laser but not heal and turn into replacement?
Oh.
I think that means for a patient, yeah.
Yeah, so if you're talking about this procedure here, the laser surgery you're watching right now, that is a laser up there. This is a Deuk laser disc repair. So we are cleaning out this stuff right here that's preventing this disc from healing. There's no reason the disc would not heal after the surgery unless the patient re-injures their disc. I mean, or, I don't know, some weird thing happens. But basically, all of these discs that are treated this way with the laser, they heal. And they heal quite properly. The only time they don't heal is when the patient does something they're not supposed to do or re-injures their disc. Okay, now it can happen, bending over. It can happen picking up something heavy, where you re-herniate. But as long as you're not bending over or re-herniating, your disc is going to heal. There's no reason it wouldn't heal. course, getting an infection could keep you from healing. So barring an infection, barring a re-injury, there's no reason the disc won't heal. So the disc will definitely repair. I don't know if I answered your question. I'm not sure I understand it if that's not the right answer, but feel free to ask it again.
So then we have another question. Oh, they said, okay, thank you. Perfect. This next question comes from Tony once more on Facebook.
Colleen?
Tony.
Oh, Tony.
Tony, yeah.
Sorry.
No, all good. He said, I understand, but what exams should I do? CT scan, X-ray, to see the root of the problem?
I'm not sure I understand what Tony's asking me.
It was a follow-up, I think, on their radiculopathy L5, and they said the MRI was clear, and...
The MRI is clear. Does that mean it clearly shows the problem, or the MRI is read as normal? I don't understand.
Yeah.
Yeah, Tony, I'm not sure what you're asking, but the best thing you can do to get a diagnosis and get fixed is to do the free MRI review at Deuk Spine. That's what I would tell you. There's no better option in life. Okay? That would be like if you wanted a Coca-Cola and your option was to drink a Coca-Cola or to have a 7-Up. 7-Up is the other options. Coca-Cola is what we're recommending. Come to Deuk Spine. Let us diagnose your problem. Let us fix your problem. That's really what you need. All right, just about done. Here we are in the corner. There's no more herniation. It's gone. And I'm pretty happy. She does have a spondylolisthesis. We get a lot of questions. Dr. Deuk, don't you have to fuse a spondylolisthesis? The answer is no, you do not. That used to be what we believed, but it turned out to not be true. A lot of times in life you learn that things you believe to be true are not. And one of them is that the spondylolisthesis means you have to have a fusion. Now, if I was doing open back surgery on this patient, then I would need to do a fusion. Because once you start doing a laminectomy, it's going to weaken the entire spine, and the patient needs a fusion at that point. But we're not doing a laminectomy, we're just doing a endoscopic annular debridement. Any other questions?
Yes,
30 seconds.
This next one comes from, excuse me, Fiona on YouTube.
Fiona's back.
And they ask, what type of anesthetic is used for the Deuk plasma rhizotomy? And if not GA, does it hurt during the procedure?
I heard what kind of anesthetic is used for the Deuk plasma rhizotomy.
Yeah, and if it's not GA, like general anesthesia,
Yeah, GA.
does it hurt during procedure?
Yeah, so the Deuk plasma rhizotomy, we use propofol sedation IV with MAC, the same we're using for this patient right now. And the procedure would definitely hurt if you didn't have anesthesia, for sure. It's painful. By the way, we're done. The nerve is going to be up here. Let me see. I may want to blast that just a little bit right there. So we're just underneath the nerve root, the L4 nerve root. And there's a little bit more of this. Come on, Nikki, I need you to turn on. If you're not going to pay attention, I can't have you here, okay? I'm sorry, Dr. Berndes, what did you say?
It's pretty much the same anesthetic that's delivered for a routine colonoscopy.
Yeah, it's twilight anesthesia, folks. It's propofol sedation, best drug in the world for basically sedation, conscious sedation. It's given intravenously. It's very safe as long as you have an anesthesiologist who knows what they're doing and you have all the right equipment. And it's short-lived. I mean, literally, you wake up and an hour later you're ready to hit the gym. It's amazing stuff. Yeah, I think we're done here. You can see we took out quite a bit of herniation from this lady's foramen, and I don't see any more. Okay? So there's the nerve right in that fat. And I don't see anything pinching it anymore. So we did a good job. You could see the herniation here on the blue towel. Henry, you want to show it?
Yep.
Luis has lined it up. Here's the scope. Go ahead. Give it to me. Can you see it, Henry?
Yes, we can.
You guys see our little collection here of herniated discs? Hold the scope. So just give me a second, Henry. We'll make a nice little picture for you here. We're just irrigating at this point, cleaning the debris out, cleaning out any blood products, little pieces of herniation that might still be in there. Is this open? Yeah, because it's not squirting out. All right, so let me show you. Just keep all that right there. We're going to move it back a little bit right there. Henry, can you still see it?
Yes, we can.
All right, no bone was removed. No bone was removed. No ligaments were removed from the spine. Ligaments hold your spine together. No bone was removed. Bone holds your spine together. Okay? No muscles were damaged. We didn't cut any muscles. The only thing we cut was the skin. And the skin heals quickly. No, we're not done. All right, can you guys see, Henry? There's the incision. All right, you see it?
Yes, we can.
And in the same view, you can see all the pieces of herniated disc that we took out. We took more than this, but these were the big ones, right? And you can see how big they are. We're done. All right, Henry, why don't you show the audience a nice testimonial. Here's some more herniations. And I'm going to head over there and answer questions. So type up your question. Thank you, everybody. Great job.
And good morning, I'm Dr. Deuk Majan here at the Deuk Spine Institute with a patient who's traveled 10 minutes from Merritt Island, is that correct?
I'm in Vieira.
Oh, Vieira, just down the street. Okay, local. You just had the Deuk laser disc repair on your lower back yesterday for a herniated disc at L4-5. It was a foraminal herniation, and it's one that is tough for doctors to find and discover, but we saw it at Deuk Spine, and you were having horrible back and right leg pain. That was yesterday before your surgery. Here you are less than 24 hours later. How do you feel?
Wonderful. Walking straight. I feel no leg pain, no back pain, just a little sore, but that's about it.
How long have you had the back and leg pain for?
Since 2012, 2013, since my surgeries.
You live with pain.
Right.
He had, I guess, a microdiscectomy done.
Correct.
Did that fix him?
No, a month later he was back in surgery.
What kind of surgery did you have done?
The fusion, S1-L5.
So you had an L5-S1 fusion, good. Did that fix your problem?
No, not at all.
And their suggestion was take the metal out, and that they already seen that he had a problem with the disc above that one, so let's take the metal out first, then within a year go back and do another fusion on the disc above that.
And that was the metal they put in you?
Yes, sir.
So they put metal in you for the fusion, and then they told you afterwards, well, we got to get it out because that's what's causing your pain.
Right.
Kind of silly, isn't it?
Yes, sir.
All right, glad I'm not the only one that thinks that's a bit silly, but that's right, it is silly. And it's not just the surgery, the fusion. Didn't you have pain management and stuff in between?
Yeah, so I had shots and a nerve specialist do some stretchings and hands-on stuff, but that's about it.
So you had shots, you had therapy, and then you had surgery, and you had more shots and therapy. And that's the problem is you're like in I think about it as like a washing machine going around and they're just washing the money out of your pockets and washing your life away because your quality of life has not been good, has it?
No, not at all.
How did you find Deuk Spine Institute?
My wife.
I couldn't believe it, amazing. Last time he had surgery, 9 days, he couldn't even hardly move. And I mean, he was up last night pacing the floors, antsy, trying to find something to do.
This must cost your family a lot of money dealing with the pain.
Oh yeah, well, and it cost him not just, with the pain, he's not able to do the stuff he likes, fishing, throwing the baseball with our son. So just just doing life things he's not able to do that because of all the pain that he goes through. So now we're just so grateful that we found you guys because, I mean, I have not seen him walk like this in 19 years.
And that's just one night.
Yeah, that's just one night.
And
so
no pain meds.
no pain meds, no anything, no medicine. He had took no medication whatsoever last night.
So just to recap, your husband, like millions of people, had back pain. He went and had microdiscectomy, which is a procedure where the surgeon basically ruins the back of the spine in order to get to the disc. That caused instability, which then he needed a fusion done shortly afterwards, right?
Yes.
You said a month later?
Yes, a month later.
And then you went back again because he was still in pain and worse after the fusion.
Right.
And they told you he needed another surgery, a third one,
Correct.
to get the metal out.
Right.
And then he was going to come back for another fusion after that.
Correct.
And then there would be more fusions and more fusions, right?
That's never ending.
Never ending. And we see this all the time with people that have open back surgery, invasive back surgery, is a cycle of over and over, more and more surgeries. Well, he's done now.
Yes, thank you. And we're so grateful.
We
You just
have
don't
one
know.
more muscle thing to fix and then we're done.
Yeah, you might have to do something to me so I can keep up with them.
You ended up having faith. You had the surgery done yesterday. You can see in the video, we made a tiny little cut, just 7 millimeters on your back, and we got the whole surgery done. We found the herniation, we cleaned out the tear. And while you were in there, I tested your disc at L4-5 above your fusion, the one that's bad. You had 10 out of 10 pain. And I asked you, is that your typical
I
back
heard
pain?
that.
Yeah, and you said yes. So you're gonna watch your surgery today. We gave you a video. Henry did a great job recording it and broadcasting it. But you're happy today. You've had your back fixed.
So I'm walking straight.
You're walking straight.
Walking straight, not leaning.
And do we have you on pain medications at all today?
No, nothing.
You didn't take any, did you?
Nothing.
You didn't need
Zero, nothing.
Yeah, with the cut on your back being that big, it's a Band-Aid. There's no trauma inside your body we're doing, so there's no need for pain pills. That's one of the nice things about Deuk laser disc repair compared to open back surgery like fusion, is that we don't do trauma inside your body. There's no need for pain medicines afterwards.
The fusion caused hernias, and I had hernia surgery.
Really?
Yeah, because of the pain pills.
So all the complications from fusion, including, I've not heard that one, having to have a hernia surgery on your groin, right?
Mm-hmm.
Wow. So there's another complication from
Yeah.
fusions. Well, you're not going to have that problem anymore, are you?
No, sir. Hope not.
Well, is there anything else you want to share with your fans out there who are listening to your story?
The best thing that's ever happened to me. I'm walking straight, no pain. I feel like I can go do what I usually do, and especially fishing.
Yeah.
I miss that.
We're going to get you there. You're
Thank you,
welcome.
Duke. Thank
It's
you.
my pleasure. Get back to fishing.
Yeah.
I just want everyone to know, please make sure you educate yourself before you do this, because you only have one life and you want to make sure you live it to the fullest, and doing these back surgeries that these doctors recommend is not the way to do it. You need to come here and at least just give it a shot. Let them look at your MRI. I think you said you can do the reviews online if you don't, out of state, but please check here first and let Dr. Deuk, go through all of your records, because I'm telling you, this is the best thing that we've ever done.
I'm happy for you guys.
Oh, thank you so much. You just don't even know how, I couldn't believe it. My son was like, Dad, you're supposed to be laying down, and he's in there walking around, we couldn't keep him in bed last night. So it's amazing.
We're here at the Deuk Spine Institute. I have a patient who traveled from Ohio to Deuk Spine Institute for his lower back. And he's been through a lot of treatments in the past that didn't really work. They may have given him some temporary results. I'll let him tell you more about that. But he's here today, a new man, just 24 hours after his outpatient surgery. He had the Deuk laser disc repair. You can see in the video we made some small cuts on his back, went in through a natural opening in the spine called the neuroforamen. We didn't do any damage under the skin, and we were able to repair the herniations that have been plaguing him now for years. How long have you had problems with your back?
Since approximately 2009, quite a while.
All right, so about, 14 years now?
Yeah.
And you've had surgery before. How were those other surgeries?
I had 2 minor surgeries. One lasted for about, relieved my pains for 3 years. Second one, maybe 6 or 7, somewhat of the pain, enough to get me through. Over the last couple of years, the loss of balance, which really affected my job, was just getting worse and worse and worse. I really didn't know what to do. And I went through 3 local surgeons, and everybody, the only answer was fusion, fusion, fusion. That was pretty much going to end my career. So
Yeah.
I found this guy.
And you had surgery yesterday. How are you feeling today?
Besides just a little bit of soreness in my back, the balance is back. I know I'm on a way to recovery.
You look a little teared up there. Yeah? It's been a journey, hasn't it?
As soon as I did the video conference with you, I sort of broke down like this too. So hoping
I understand.
they'd be back.
So can you tell a difference at this point now that you've had the surgery?
Oh yeah.
Yeah?
Yeah.
You said you got up and you walked straight this
That's
morning.
I haven't been able to do that for over a year without falling. I couldn't walk down a hallway without
Yeah.
grabbing the walls.
And the reason for that, your nerves were getting pinched pretty bad. And we went in there and unpinched them during your surgery with the laser. And we did not have to do a fusion, and you're not going to need a fusion. That's the great news.
Yes, it is.
And is there anything else you want to tell your fans out there?
I just hope more people that these doctors are only giving them that option, fusion. Come see this guy and don't ruin your life.
When do you head back?
Sunday.
Sunday. You're going to enjoy Orlando for a little
I'm
longer?
gonna try, yep.
Yeah? All right. We'll try to make it out to the Space Coast and go see the rockets over at the Kennedy Space Center. It's pretty cool over there.
Okay.
All right, sir.
Thank you, sir.
You're welcome. My pleasure. Let's get you guys out of here. Come on. Hey, good morning. I'm Dr. R. Deuk, CEO and founder of the Deuk Spine and Deuk Joint Institute. I'm here with a patient who's traveled from Pittsburgh to Florida. And what brought you here to the Deuk Spine Institute?
Well, I have had back pain for so long, and anything and everything we didn't help. My wife did significant research. We found you online, actually, is how it started.
Excellent. And what kind of procedures did you have done before you came to Deuk Spine?
I've had 5 lower back surgeries, 1 fuse, and the others laminectomies and so on, all within the last 3 years.
And they were recommending another fusion for you, weren't they?
They were. That's when I really began to research other options. When they mentioned another fusing, I absolutely was not going to do that. So that began a research that ended up finding you.
The Deuk Spine Institute. And what we do differently, folks, is we cure pain with one procedure. Patients don't have to keep coming back having multiple procedures and pain management. And that's kind of where you were. You were in that surgery, pain management, surgery, pain management, surgery, pain management, back and forth. And that goes on if you keep doing it for the rest of your life. But you found a way to get out of pain and you came to Deuk Spine. How do you feel today?
Unbelievable. I have not felt this good in years, several years.
And you feeling good because we put you on some new pain pill that nobody else has?
Absolutely not. I've lived on pain pills up to this point. I'm on nothing. I have a prescription for some muscle relaxers, no pain pills. I'm on nothing.
And how did Deuk Spine Institute fix your back?
Had the L3-4, L4-5 laser surgery, and then the rhizotomy that was done a few days later. A combination of those two, I'm pain-free. I'm really pain-free.
I'd just like to point out that you, like many people, had more than one source to your back pain. You had discs that were causing the back pain, facet joints that were causing the back pain, sacroiliac joints that were causing the back pain, I think a piriformis that was causing the back pain. And because you were walking so funny, you were getting bursitis and other pain in your leg from the iliotibial band. We had to identify every one of those sources and treat everyone properly. And once that was done, it eliminates the pain permanently.
I have dreamt of feeling this way for years. Teared up a little bit this morning when I woke up. I could get out of bed without holding onto the wall, or it was just an incredible feeling.
Well, I'm very happy for you, and you could see we did your surgery with the laser, cleaning out your discs. Where did you go for your spine care? Was it a good center?
Prior to coming here,
Yeah.
I was at 2 major medical facilities in Western Pennsylvania and Eastern Ohio. Went through a lot of pain with the different procedures and surgeries I had done, and had no relief.
And what were these other facilities, you can say?
UPMC and Cleveland Clinic.
Yeah, 2 of the top spine institutions in the world, right?
Yes.
Great reputation,
Yes.
and yet they couldn't get you out of pain.
No.
And they were just ping-ponging you between surgery and pain management, surgery and pain
That's
management.
exactly what happened. Yes.
And there's no hope for actually getting cured because they don't have the cure to back pain. We do. Unfortunately, we've been trying to share that cure with them, but they're not interested. They just want to keep doing fusions because, well, let's say it, fusions make a lot more money than laser surgery does. It's hundreds of thousands, if not millions of dollars over your lifetime. That said, I'm glad you're doing well. When are you guys heading home?
Getting on a plane in a couple hours.
All right, very good. Is there anything you want to tell people out there in final remark?
I would just say that Deuk Spine Institute has been a lifesaver for me, literally. I would highly recommend it. I was being ping-ponged around for 5 years. I have dreamt of feeling like I feel right now for a very long time. So I cannot thank you, Dr. Patel, your entire staff. Everybody's been just incredible.
That's what we're here for, my friend.
Thank you, Doctor.
Give people back their lives.
Yes, thank you, sir.
All right, now go enjoy your Top Golf.
I will now. I will now.
All right, let's get you out of here. I'm here with a patient of mine who traveled all the way from South Carolina to come to the Deuk Spine Institute. She's a healthcare provider herself. She's had some back issues. She had the Deuk laser disc repair yesterday, and she wants to share some of her experience with you. Tell us about your back pain and your leg pain before your surgery yesterday.
I had surgery on L4-L5, L5-S1, so my symptoms were classic. I had the sciatic pain that ran down my leg. Every once in a while my foot would go numb if it was pretty irritated. And then I had pain along the top side of my hip. So pretty normal type stuff. I was going to the chiropractor, I was getting massage therapy, I was starting on meds once I did imaging and made sure that this was actually a herniation and not just like a muscle pull or something. So I had kind of gone through all the things. Had back surgery in 2020 at another institute, and they did a microdiscectomy / laminectomy of L4-L5. I was good for maybe 2 years, almost 2.5. Before it re-herniated. So not the most fun in the world, because you expect whenever you go to have a procedure that it's fixed and your life will be ongoingly better. But I'm a nurse and I ride horses, so I'm pretty mobile all the time, and that kind of pain just really gets you down.
So why did you travel from South Carolina to Deuk Spine? What do we offer here that you couldn't find there?
I was on an internet, the great internet search, to find out more information. So to read more about spine surgeries, about how many times people relapse, like all what's involved. I surely didn't want to go up to a fusion because that's absolutely ridiculous. So I happened to find one of your videos on YouTube. You offered the laser therapy. I was just sold like almost as soon as I saw it, because it made sense to me.
Yeah, having the perspective of being a nurse and a healthcare provider, it makes sense. You're fixing the problem, debriding the disc tear, allowing it to heal naturally into a pain-free state. You had your surgery just yesterday.
Just yesterday.
Not even 24 hours ago. Were you in the hospital for your surgery? I
was here in your surgery site. I got here around 1 o'clock-ish. Did all my pre-op stuff. Rolled in probably around 1:35. I think our procedure lasted not quite an hour. I was out and eating dinner with my dad at 5 o'clock at a restaurant that your anesthesiologist recommended.
Oh, good.
Dr. B, he's great.
So no hospitalization.
No.
No morphine pump after surgery because you're in so much pain from
Not
the
at all.
surgery. No narcotic painkillers after surgery, right?
No.
What did you take for pain that we gave you? What new medicine did you take after surgery?
So I haven't taken any new medicine after surgery. I was on Robaxin and gabapentin prior to. Of course, I have to wean off gabapentin, so I did take my gabapentin this morning, but I didn't wake up in any pain. But unfortunately, that med you have to wean off of, so it's not like I can stop it to cold turkey.
Yeah, so basically we did a small incision, we went in with the laser and debrided your tear, and at the end we had a tiny 7-8 millimeter incision, and there's really no pain after the surgery, so there's no need for narcotics. After your prior microdiscectomy, you probably needed to take some Percocets or oxycodone.
Just to roll out of bed, just to get up off the couch after that surgery.
It's painful.
It's painful.
Yeah.
It's absolutely painful.
And the difference, people ask me, what's the difference between Deuk laser disc repair and a microdiscectomy? The difference is a microdiscectomy goes straight into your spine. The surgeon has to pull all the muscles off your spine. Then they have to drill a hole in the bone to get to the disc. And they have to remove ligaments, and they have to take your facet joint partially out. There's so much destruction that goes on under the skin. The surgeons don't talk to the patients about it because
no, they didn't.
Everybody does it. They think there's no better way, but there is a better airway. It was developed by an orangutan